Now we will talk about fear. Fear attacks the kidneys. We have often heard the phrases, wait, wet their pants and fear, or get jelly legs when one is afraid. This refers to the bladder and the legs, both of the kidney and the urinary bladder. But it is possible that fear or anxiety could cause tachycardia or diarrhea. This is because when even though fear affects the kidneys, it could also affect other organs in the body if they are deficient in some way. For example, fear may cause frequent and urgent stools, such as if the large intestine was already yin deficient, so that the yang flowing in from kidney and urinary bladder could easily cause a yang hyperactivity in the large intestine. Similarly, a person with heart yin deficient constitution may get tachycardia from fear, but the kidneys remain the point of attack, and therefore, where the energy is consumed by this pathogenic fear factor. Okay? Fear can make us behave in different ways, depending on the situation and our constitutional type. If one is attacked by many people, it would be futile to fight back. Or it could be that a physically passive person is not naturally able to defend himself or herself physically. The fear experienced in this situation is a passive fear. One remains passive and helpless while suffering the attack, and it would further consume the kidney and urinary bladder yang. If the situation is too fearful, this could consume the kidney yang overnight and cause graying of hair, incontinence, night urination, and affect the reproductive functions. One of the kidney and urinary bladder yang is consumed, the person will become fearful about the most ordinary things in life. And this fear would make them more passive, which means that they are unable to do anything against the fear and they just let it restrict their lives. They will do less and less in life because the fear makes them more and more passive. As treatment, the kidney and urinary bladder yang should be tonified. If any other organs manifest symptoms, they ought to be treated accordingly. It would be also good if the object or situation of the fear would consider it in the therapy.
Okay, unmute po.
Example of passive fear. A patient has fear of flying and has not taken a flight for the last 6 years, even though she was an active traveler in the past. She has sought treatment from many different therapists and likes talking about her feelings, but will not book a flight. When talking about it, she breaks into a cold sweat and turns pale and is close to fainting. She actually has a mental block and cannot visualize herself inside a flying aircraft. This fear is affecting her life as she would like to see other countries and places, but her traveling is now limited to within her own country. So treatment, this is clearly a passive or a paralyzing fear, which means that the patient is becoming less active or chi deficient in the kidneys. The cold sweating, turning pale, nearly fainting also signify heart, blood, and chi deficiency. Fear of flying is often a problem associated with a need for protection around oneself, like the skin, for instance. These patients prefer to be on the earth and within 4 thick walls, not in the sky with the end nowhere inside. This is a lung chi deficiency symptom. So kidney chi blood and heart chi and lung chi is the effect of passive fear. Okay? Now, points against the fear, kidney 3, UB67, and UB23 can tonify kidney yang. Points against the physical discomfort, use REN 14, UB15, UB17, and P6 will help with the heart, blood, and chi deficiency. Points against the object of the fear, use lung 10, UB13, and LI11 to tonify lung chi. Active fear, however, is different to the above. It does not prevent one from attempting any activities, but it makes the person very tense and consumes much of their kidney yin and liver blood. The person is exhausted after these fear-causing activities, be it a confrontation or fight, or a session of bungee jumping, or an interview or examination, and needs a few days to recover from it. A prolonged period with this kind of emotional state could seriously consume kidney yin and cause the burnout syndrome, which may lead to a depression or heart yang hyperactivity. So it is illustrated here that kidney yin deficiency and uncontrolled by hyperactive heart yang, because kidney deficient yin can no longer control the hyperactivity of the heart yang. So continue po siyang nag-i-increase. Okay? Points to tonify kidney yin is kidney 7, REN 3, MOP, point UB, spleen 6. Points against hyperactive heart yang is heart 5, loop, connecting point, and REN 14. Points for calming is DO 20 and liver 3.